Let's all say it one more time together. Om Shanti. Thank you. And a very good evening and a very warm welcome to all of you to yet another refreshing Sunday evening talk for this week. So, our topic today, or the talk, is more centered around health awareness. And the topic, as you might know, it is ENT essentials. So, understanding the issues with respect to your ear, nose, throat, and head neck region, and also debunking a lot of myths around those issues which we might have. So, a special welcome to all of you. And just for the introduction of our first time visitors here, I would like to start with a brief introduction about Brahma Kumaris and Shanti Sarovar, the premises where you have come in for the session. So, Brahma Kumaris is a worldwide socio-spiritual organization which is aimed at making better society via making people better through the power of meditation and divine wisdom. And we are spread across 110 countries with centers, with 8,000 centers as of now. And the premises is Shanti Sarovar. It's the largest retreat center in south of India of Brahma Kumaris. And we host a lot of conferences, retreats, depending on different areas, medical, IT, media, etc. And a lot of workshops as well, and the meditation retreats as well. And we have this as a divine learning place as well as a added charm of the nature, which you all might already be enjoying, the divine nature we have across. So moving further on, I would like to invite our guest. So we have Dr. Priyanka Valluri with us for the session today. Please let's give a round of applause to welcome sister. So Dr. Priyanka is an ENT consultant and she's working with KIMS Kondapur and Government Hospital Gachibowli. So she's specialized in the issues with ENT, that is your ear, nose, throat, and she's also a head neck surgeon. And all these issues for adults as well as the children. So not delaying further, I would hand it over to Dr. Priyanka to take further for the session.
Hello. Yeah. Hi, good evening, everyone. Om Shanti. I'm Dr. Priyanka Valluri. I'm working as a consultant ENT surgeon at Government Hospital here down Gachibowli and KIMS Kondapur branch. So before beginning the session, my team will hand over a pre-test questionnaire. So this is not to, test you or, something. We'll have it one-sided. So we'll have the session two-sided. We'll have it like you have questions, you raise it. Before you raise, let me see if I can do real justice clearing your doubts before you get some. So this is the main concept of our talk today. So we'll have it a two-way session. So uh, can you please distribute the questionnaire? So this questionnaire has two sides and the questions are same on both the sides. There's a pre-test and a post-talk questionnaire. So whatever you think, please mark your answers on the pre-test initially. Then after the talk is over, what you have gained through or whether you have understood something through my talk, then the post questionnaire will give you those answers. At the end, we will collect your sheets so that we'll also be able to know whether it has been successful, are we efficient enough to clear your doubts. So I'll just give you 2 minutes to just go through and we'll start with our session. Pens will also be given to you. I hope everyone are comfortable with English. Telugu, Hindi, I'll try to inculcate in between, but so that it will be comfortable for everyone in English, I'll try to put it more in English. I'll try not to use most of medical jargon and medical language. I'll try to reduce so that you will understand it better. But don't worry seeing the first line otorhinolaryngology because that is the first one. ENT, ear, nose, throat. So in medical, ear is called as oto, nose, rhino, and laryngology comes with oral cavity, throat, the neck region, and everything. So that is the first part here. I'll just give you 2 minutes time and I'll start with the session. So you've read the pre-test, pre-talk questionnaire, right? In this presentation, it won't be like, something where you go for a CME or some place where continuous slides are there. We keep reading it, we keep telling it, and you start feeling more like a classroom. But it is not that. I will talk, but ENT is such a branch where if you see things, you understand it better. If I keep on talking, everything will go above head. So I am here with a few pictorial kind of images. Don't take it like, oh my God, is it this scary or something? Just for you to understand it clearly and in a simple way. That's how we have planned this presentation. So mainly we are here to tell you about, see, the everyday mistakes you do. Small things, ఇది మనకి తెలీదా అని అనుకుంటాం. But those are the things where we make mistakes. We think we know it, it is okay to use it, it is okay to do that. But in a long term, how do that it is okay or is it okay things matter a lot for us is what is concentrated in perspective to ear, nose, throat. Okay, so basically, five senses we have. Can you tell us, anyone, what are those five senses? So, sight, smell, touch. So, if you see, in all these five, three of them are in ENT: hearing, smell, taste. The three which are there, which are very important, that means these are the special senses. How much ever importance we give to our eye, we should give double the importance to our ears. And smell, taste, everything we feel, it's okay. If one is not there, we'll feel. But it is all the God's gift that we have got are these special senses. Even touch, if we not have, we'll get worried immediately. What is it? I'm not able to perceive some area. But if you're not hearing, the hearing is reduced, you'll feel maybe there is a bit of a problem. It will get back on its own. But do we do the same thing with eyesight? Slight blurred vision. We run to an ophthalmologist. I'm not able to see properly, check it, and we get specs. But do we do the same when it comes to hearing? We don't. Suppose the smell reduces. We feel maybe I have caught a cold. Let me see, it will reduce, and then I will think about it. But no, we cannot take chances. This is what the information is lacking with all of us. Even before me coming into ENT, I used to think the same as you. But the perspective changes when you know the basics of anything. We are not expecting or thinking everyone should know everything. No, because we are busy in our own lives. But coming to our own body, we should know the basic few things which have to be dealt with. So in ENT, as we have ear as the first one, I will begin with the ear part. But if there are any questions or if you have any doubts in between, please feel free to stop me and I will clear it. Or 2 minutes away, if I finish it and your doubt is cleared, fine for me. But if there is anything, please let me know. So, as I said, please do not take it as a class. Just briefly saying. So, this is the external part of our ear. From here to here, we take it as outer ear. From here, this is our eardrum. From here to here, we consider it as the middle ear. From here, this part is considered as our inner ear. So I've taken a very everyday problems that we have, simple ones. If you have any complex issues also, you can ask me. But as I said, we will not go through the textbooks or anything in detail. I'll make it simple. So initially, first the issues, everyday issues which we get in ear, they're basically in the outer ear area. Ear pains, something frequently we get, or some muffled sounds, unable to hear, all these things which are there. I will tell you one by one briefly. Okay? So, first doubt everyone asks us is, can we use earbuds to clean the ears? That is there in your pre-test questionnaire. So, firstly, in every person from here to here, this length changes. It is not the same for everyone. And wherever wax starts, it starts here and then it gets pulled up the whole place. So, what happens? When the wax is here, you feel a bit of itchiness, dryness, you feel the urge to use some earbuds, or I have to get out of it. Dryness in a few people, all that will be there. So you come with the earbud, you try to clean it. But what happens is, whatever the wax stays here, you think it is coming out because when you pull out the earbud, there is some wax attached to it. So when you see that, immediately you think, oh, the wax has come out, I'm free, my ear is good. But the main thing what happens is the skin which is there in this area is very sensitive. First thing is, no need to clear the wax in your ears. Why? Ear has its own cleaning capacity. Whatever the cells are there here, what they do is, we know new cells are formed each time. So in the ear, there's a specialized structure where the cells move out. The old cells keep moving out by themselves, pushing out the wax. So whatever wax is formed, there is no need for us to clear. It will come out by itself. When we chew, when we talk, there is the movement of this area which will make the wax to come out. When we do not drink enough water, when we do not dehydrate ourselves, or when you do not chew properly, మన పెద్దవాళ్ళు ఏం చెప్పేవాళ్ళు, chew your food 32 times before swallowing it. This is one of the reason for that. Why? Because when you chew it so many times, all the joints, the muscles over here keep moving, making any wax or any impurities in the ear also to come out along with the cells. But today, these days, in our busy lives, 2 minutes of food, eat fast, go away. Or we keep a plate, we keep a phone or a TV in front of us, we do not concentrate on how we are eating. So that might be a problem for these small, small petty issues to rise up. So when you use this wax, instead of taking it out completely, when you use a bud, you push it. You do not know where the eardrum is. And what could be done? You might injure your eardrum. There could be a hole, or in few patients where the skin is very sensitive, some bleeding also might occur because the skin is very thin there. So do not worry. Suppose you use a earbud and it starts bleeding, just come to us. Do not panic, do not think something has happened. Sometimes only laceration of the ear canal also might cause bleeding. So anyone has a wax, please do not use anything to clean your ears. It will come out by itself, or if you really feel, just a cotton cloth would suffice. Just do it like this. Our grandparents used to do when we were very small. Just do it with a cotton cloth, clean and leave it off. That is the best way for a 2-day old and an 80-year-old. That is the only way we have to deal with our ears with utmost sensitivity and care. Then how we do it? We ask you to use some eardrops, seeing the condition of your wax, whether it is very hard, semi solid, or very mild. If it is very mild, we ask you to just use the drops, it will come out by itself. Even those drops, what to use, are specific. Not all the drops available out at the counter are used. Then we use some suctioning kind of an equipment or instrumentation which is specific to us. Now in the market, there are so many instruments, so many kinds of buds and new things. But everyone think, okay, I have seen with a light, phone light, I am able to visualize, I will remove it. Please don't do that. As I already said, there is a possibility to injure your external auditory canal as well as your eardrum. So let us avoid that. We are here to help you. So please come down so that very efficiently only Underview will help you out with this. Next one, as just I told, eardrops. Anyone has an ear pain, an ear blockage. Most of them, what they do, they go to the pharmacy, get some eardrops, use them for 2 days, and again they come running back to us. I've got an ear pain, I use these drops, and it has aggravated more. Now, there are so many conditions, and the person you go in the pharmacy, does he know what problem you have before giving the eardrops? Do we put any drops in our eyes randomly? Then why in the ear? Because there are so many conditions and so many different types of drops that we use. I'll give you a few examples on how we do that. Suppose you have, this is wax in your ear. Okay? When you have this kind of a wax, it is hard, impacted, it has come almost till outside. For this, we use a separate kind of drops which will melt your wax. It has the dewaxing capacity. Even after using that, if it is minimal, it will come out. Otherwise, as I previously told you, we will remove it after it becomes soft. So these drops also, how you use it matters for it to become soft and for us to remove it. Then this is a kind of a fungal infection. For this kind of an infection, if you use the same drops that you were using for this, it will not be of any use. How do we know that's a fungal infection? We do a clinical examination for that and we confirm what is the diagnosis first. Is it a normal wax? Is it a fungal infection? Or is it any other infection that is causing? So, according to the problem, there are different drops. So, any ear pain, any ear problems, please do not visit your nearest pharmacy to take. We have varied conditions, and there are people for whom there were some adverse effects because of these eardrops also and have landed into sepsis, means severe infection. So we don't want that. In the same way, see, this is the redness, this is the eardrum infection, this is the eardrum. See, here you can see this is the eardrum, this is the fungal infection here. Here the eardrum is also very red in color. So there are different conditions like myelinitis and all. And here comes using the earbuds, you might cause infection of this lining, whatever I told, canal, and because of which there is some pus coming out, some wax. You see, here it is all remaining. Using the earbud, when you have your ear canal this much, it's easier. But using the buds, it will become narrow like this. When it becomes narrower, then starts your real pain. And when you come with us at that point, we can't even visualize the eardrum like this. So then, again, the same place, do not use any drops. We will guide you the way how to deal it. So there comes the important place. Can we use ear drops? Can we use earbuds? No, please do not, because it causes more damage than the relief that you are expecting with. And there is one more condition where the previous picture I showed you, the middle ear, even if there is some fluid in the middle ear like this, means there is an infection which comes through your nose to your ears, at that time also you'll have an ear pain and you might have blocking sensation of your ears. At that time, if you use the ear drops, they're only till here. They do not cross your eardrum and they cannot go to the other side to give you relief. So in this specific such case, using an ear drop is totally waste because it will not solve your issue, it will not penetrate and it will not give you any relief. So when so many, these are very commonly found conditions, they are much more beyond this. Why I have pointed these is, these are the everyday things that we keep seeing. So this is the reason we tell you, please do not use any drops. Can you please give the pretest sheets to the new people coming? Yeah. So, this is your eardrum as I previously told you. So, till now I have told you about the external auditory canal, that is the outer ear where the problems could be there. So, mostly your itchings, your blocked sensation, all those things, the ear pain part, which could be there from that, those are the general things. Now, when we come to the eardrum, this is very thin like an onion paper. Onion peel, if you take out a small thin sheet, how thin it is, the eardrum is also very thin like that. So we have to take it, take a care of it like a small baby. Otherwise, anything happens to it, surgery is the only way, trust me. Because suppose there is a perforation to your eardrum, you've gone to a doctor, they said, no, there's a hole, you have to operate it. We get panicky first. Oh my God, what? I have gone for the first time. I just told there's an ear pain and they're telling we have to go for a surgery. Yes, do not think they are telling you something out of their own interest. No, eardrum is such a sensitive one which will repair itself only at a few specific points. But once the perforation is bigger, the infections are higher, it cannot repair by itself. So what are those? So this is the first one I showed, the infection of the eardrum itself where the redness comes. And sometimes the fluid bulges will be there. And this is the main one where if there is a perforation, it could be of various sizes. Initially, when it is very small, it will heal by its own if you take proper adequate care. But If the size increases, it is going from mild to moderate or moderate to severe. Please trust me, surgery is the only option. To how many ever doctors you go, to how many ever you meet, this will be the only thing. And the best part is 100% recovery rate. That is the best part for ear surgeries. The doctor you go to, the person who does your surgery, and your care after the surgery matters the most for ear surgeries. Because even if the person does it all right, perfectly for you, but you do not take good care of it later, there are a few pointers which should be followed for some prolonged period of time. If you don't take that care, even how 100% 200% good we do, the result might not be as expected. So these are the things which can happen to your eardrum. Sometimes when you're cleaning your ear, an earbud gets pierced, and there that we call as a traumatic perforation. Sometimes in such kind of perforations, the eardrum will close on its own if we do not let water to go in, and particularly in that, do not use any kind of eardrops, because we have done the perforation with our own hands, with our own means. In such situations, just leave it dry, let it be like that, it will heal by itself, it will close off. If we intervene, put some drops, the dirt, whatever is there in our external ear, will enter into the middle ear space, which needs to be sterile, where only air needs to be there. We are introducing some liquid to go inside. So, any such kind of a situation you face, please make sure you do not use any eardrops, or you do not put any. People put hydrogen peroxides, or they put some oils in the ear. Please do not do anything. Without intervening, it will heal wonderfully on its own. That is one thing. So, there is one tube which connects the back of your nose to your middle ear space. This tube is specifically called the eustachian tube. Now, why I am specifying this to you? This eustachian tube plays a very major important role in all of us, mainly in children. Most of the children, they keep having frequent colds, end up getting ear pains, and they come to us. This eustachian tube is the main one which is responsible, because when this connection is there from the back of the nose to the ear, you can see how the tube is there in a child and in an adult. So it is straight, stout, and short in children. So the length is not very much as in adults. So whatever, whenever they have a cold, the infection from the nose easily goes here and settles down. And for it to come out, it is difficult, because if you have gone in a flight journeys, you feel your ears blocked, means the outside pressure and the pressure in this place is reduced. There are pressure differences, and that time when you yawn, or when you do a valsalva manner, like close your nose, blow up your cheeks, it gets blocked, then you swallow, it gets opened. The same thing is for this tube. This is the tube which is responsible for all that. So what happens when the fluid enter into this place? You feel a dullness in your sound. You feel it is blocked. How many times you do this Valsalva maneuvers, or you try to yawn, or we just keep doing like this. We try to think something is there in there and it'll come out. It will not come out, because it is all here. So what happens? The fluid, when it goes, it settles like this. Sometimes when we do a clinical examination, in the eardrum, we'll be able to see the fluid levels like this. So if that fluid is thin enough, it will come out on its own. See here, you see this redness. Why this? When it is getting infected, the tube also, it will get ఇన్ఫ్లేమ్డ్, అంటే ఎర్రగా అయ్యి ఇన్ఫెక్షన్ వచ్చి ఏదైతే ద ఫ్లూయిడ్ హ్యాస్ గాన్ ఇన్సైడ్, ఇట్ కెనాట్ కమ్ అవుట్ యాజ్ ఈజీలీ యాజ్ ఇట్ వెంట్ ఇన్సైడ్. And do you think a lot of fluid is required to stay here? Hardly 0.1 ml or 0.2 ml is enough to cause infection here. You can know how small is that quantity, but how much problem it creates. So in this case, we go for a combination treatment. First, identifying the issue is important. It doesn't mean only children get it. Everyone gets it. Children adults. Why is it more in children? Because their immunity is low. They're prone to more colds, coughs, they get it, it reduces, the other child has it, again it gets back. So in that case, in children we see it more, but it is as well common. And when you go for swimming also, you think I have blocked my ears, I kept them safe, I'm swimming, water will not go in. Even if water goes in, it comes out. But after 2 to 3 days, you get back to us saying, I've taken good care of my ears, I've used plugs, my cap was covering my ear, but still I feel there is something stuck. That is through this. Through your nose. When you're swimming, obviously you can't close your nose. So the water goes through the nose inside. Through this tube, it enters into your ears and it will cause this problem to you. Till this fluid is thin and we act on time, it will come out with the medication, no problem will be there. But if this becomes thick, the fluid thickens, then we will go for a small procedure where we will put a small nick to your eardrum, remove all the thick fluid, and place a small button. So that is called a grommet. So that whatever fluid is more, formed inside, it will come out on its own, and no need to remove it also. It will come out by itself and we are comfortable. This process is done very frequently in other countries. But in our place, normal procedures only, we are scared. Now doing such things in children means, madam, is there no other way? Please tell us some medical way. So what we do is, when we identify it early, initially we'll go with 2 doses of medication if it is not coming down. And there are some tests also, hearing tests also, to confirm if the fluid is still there, how much are the hearing values. So after one course of medication, we do the test. If it is clear, you're happy, good to go. But instead of doing the test, 2 doses of medication, still it is there, then you're suggested to go for the procedure called myringotomy with grommet insertion. Am I being too medical? You're all okay with it, right? You're able to understand it, right? Because I don't want it to be like a seminar where you sit and listen to it. That is my main concept. So that is the thing. And most of us have vertigos going on. When we have a dizziness, vertigo, first we immediately think of the brain. Something is wrong with my brain. We run to a neurophysician, they order an MRI, we get all that done, and we are like, everything is normal, then why? Why is this happening? So, main thing which most of us do not know is, ear does 2 things. It does the balancing in this part and the hearing. It does these both things. So whenever there is any problem to the balancing part, then you might get a vertigo. There are a few issues where patients complain of reduced hearing, dizziness, and a ringing sensation in the ear, some gee kind of a sound, especially night times it is seen profoundly and all that. So at such times we need to observe this, know what is actually happening, because trust me, there are n number of conditions even for this. So that is I'm briefing you. See, these problems, please come to us. Do not think it is something very big and run to a very super specialized doctor, or it is a very simple one, a general physician is enough for it. No. You need to know which problem to exactly go to which doctor. That is the main thing. So when we come here, this is the balancing organ as I showed you here a bit more clearly, and this is for the sound. So these nerves which are connected, they go into the brain. So what happens is, there are the small structures called otoconia. So when you move in direction, these otoconia, they have to come back to the original place. But due to some circumstances or some pathology problems, they don't come back to the original place. That is when you feel vertigo. Now I'm like this. I have turned, but I'm seeing you. So it is intact. I'm not feeling any dizziness because my otoconia have come back to their original place. Or I'm like this. I have turned. I've changed my vision also, but still I don't have any dizziness because all of them are in proper position. Few of them, after sleeping, you suddenly sit and you feel you get dizzy. That is because of this position change. You have sat for a long time, suddenly you're standing. You might experience some dizziness. Firstly, do not worry. Any kind of a dizziness is not a very big, huge problem. The problem only comes when you fall down because of it. because we are scared about your head injuries or elderly people, any fractures happening. That is the only point of getting scared for a vertigo problems or dizziness problems. So even for these issues, we have specialized tests going on where we will get the exact diagnosis, whether it is because of your positional change or any inflammations in this area, any infections going. Few people with viral fevers suddenly tend up getting these. At that time, what should be done? What is the accurate diagnosis and treatment? So these are the things which we have to be careful about. So any questions you have till here? Any doubts you want to clear regarding ear or any specific things? You're free to, ask. Please. Nothing, sir. Exactly, that's what I'm telling you. Previously, they used to say we used to put every week coconut oil. Few of them, once in a while, hydrogen peroxide, it will all come out. No, because you're putting unnecessary weight on the eardrum. So, what happens is it cannot take so much of weight. It is very thin, even that one drop can sink it down. So, repeatedly putting it, it might damage it. That is the reason I'm telling you just use a cotton cloth. Do it like this, clean your ears both sides. In case there is any small amount of wax, it will come out by itself. If you are feeling any blocks, why do you put a coconut oil? My question to you. Why do you want to put coconut oil? Exactly. So, do you know that really wax is there inside? That is my point. You have a blocked sensation. That blocked sensation could be because of wax or the fluid in your middle ear or any other problem. So, wax is not the only problem for your blocked sensation. And using these, when you have an absolutely healthy ear, outer ear, until your eardrum, everything is healthy. And on top of it, when you put it, you're causing problems. So don't do that. No coconut oil. We don't put the same coconut oil in the eyes, right? That was my first point. You don't put coconut oil or any drops. Even now we are saying water, cleaning water also, your ears and all. Please don't do it because there's so many microbes in the water that the tap water we get. If you really want something like that, get a small normal saline bottle which is sterile, sanitize your hands, take that, clean it, wash it. Because when you use a direct water, tap water, or even your RO water, those are very sensitive organs, and few things, a damage occurs, it might not be reversible in a few cases, which we don't want to risk. Your doubt is cleared, sir? Any other doubts you have, please? The earwax could be there. Yes, that's what I'm telling you. So, there are two different types of wax, dry wax and wet wax. It differs from person to person what type of wax you have. We cannot tell that. But when you're hydrating yourself well, you have these proper jaw movements going on, it will come out by itself. And if it is really not coming out and it is impacted, first we see it clinically. Clinical examination is done. And accordingly, we'll suggest you what drops to use, how many drops to use, how many times in a day to use, and how many days to use. See, there are so many factors in using the eardrops also. If you just use 2 drops once a day and get back to me saying, I have used the drops, please clear the wax, it will not come out. Yes, yes. At least 3 times. At least 3 times. Morning before leaving to your office, you can use once. Immediately after coming back, you can use once. Before sleeping, you can use once. See, why we are using it is to melt it properly. And we do give you instructions on what to do after putting the wax also. It is not like you just put them and leave it. You need to allow the drops to go inside. So put it, move your ear, press it, let the drops go in, and get back to normal position. If it comes out, it will come out. Do not put a cotton after you put the drops. It is of no use. Do not put cotton thinking it will be there inside for a long time, it will melt it more. It will not. Whatever action it has to do after putting the drops, it will do. And once it's out, it's out. That's why we use it more number of times. The more number of times you can put, the more it will act. At least 4 to 5 days, you need to use it like that. 4 drops, 3 to 4 times every day for at least 5 days. Then it is ready to be removed. Otherwise, it will be painful to you, unnecessary trauma to the ear, and we don't know how near to the eardrum it is. So, taking all these precautions and the latest methods of removing, we do it. You're feeling bored? No? Okay. Any other doubts? Anyone? Nothing. You have a problem now? That's it. No need to be sure. See, you're happy, healthy, you're able to hear well. So that's what I said. Just take your towel is there, right? Or a thin cotton kerchief. The end of it, just make it like this. Clean with that. Whatever is there, it will suck it off because it is cotton. But do not use any earbuds. No swabs. Some people, what they do, we tell not to use ear swabs, right? They take direct cotton, put it inside, and unfortunately, it goes inside and stays there. It can't come out. Again, they come back to us saying, I've tried to, remove it. You told not to use a bud. We used cotton, it went inside. Again, we are the ones who have to remove it out. So just a cotton cloth, just put it inside. It is done. That you can do. But I'm telling you, these general practices which I told you, if you follow, 90% you will not have a problem. See, I'm losing my business. No, I'm telling you not to do, not to convince. What is the benefit for me? But the main point is you need to know what right to do. If you have a problem, if you have a blockage, then don't do anything on your own. Come to us. We will see and we will suggest you. But these basic practices, which our age old grandmothers used to do, they are the best things. They will help you out. No need to put anything in your ear. After doing head bath, just with cloth you clean it. It's done. Enough.
Just
Same thing. Even after swimming, cloth, just do it like this. As I told in the previous one, if it is gone through this tube to your middle ear, then we have to see it accordingly. We have to treat you because this place, if the water goes and settles down, how much ever you clean it from outside, it will not. Nothing. The trainer who you have, they will teach you on the breathing techniques while swimming. That is the main reason while going to swimming, starting swimming classes, we ask the parents, even if adults are going, please ask your trainer for proper breathing techniques, how to do swimming. At that time, you go inside the water and you breathe. What happens? It goes, comes to your throat. Sometimes we see a lot of children spitting then and there. Few of them go to the end and do. So the same time when it comes back, it might enter into your ear. So those, yes, nose. So the breathing techniques are important while swimming. That is the only part. Once it is inside, we have to use some medication, get it out, and we'll ask you to take a small break from your swimming till the infection is down. Then you can resume it back. Yes, please.
I think she has already asked some of the things, but just an extension of that.
Yeah.
Is there some yoga or meditation exercise which could help? Not meditation, but the breathing exercise rather. Would it help in general, well, taking care of things, keeping things in control?
Definitely. See, because all these structures, they are connected to muscles. Whenever the small, minute muscles are strengthened, when you do these breathing exercises or any movemental exercises, your muscles are strengthened, your immunity is good. This immunity topic is a very huge one, basically. It depends on the type of food we eat, the everyday practices we have. So, mainly the yoga we do, the breathing exercises we do, or the kind of food we take, all these help us to increase the strength of our body and the immune system. Doing these, we can reduce most of these. But sometimes, as you asked, swimming, can we do anything about it? It is only the technique. And anyone can get it anytime. Even the most experienced swimmer also, suddenly they breathe in. At that time, it might not enter. Fate, it might enter, land up into infection. But not every time that it enters, it causes infection. Please note it. Because the tube might again open immediately, and whatever has entered also can come out. Because the swimmer is a professional one, they already have grip on their system. They know the techniques to open it out and send it out. So they might not be experiencing. But the starters, whoever are there, who are new to the techniques, might end up in this. You feel a blocked sensation, and when you move around, you feel something is moving in your ear. That is the main thing. At that time, when we see, in few cases, what happens is, suppose there's a wax also, and the water enters inside, this water will land up behind the wax. At that time, also, when you move, you feel that moving sensation. So, it could be because of the water behind the wax or in your middle ear. So swimming, see, there are so many different angles to one issue. So not every time that you're swimming, there is an infection in your middle ear. Not every time it's in the outer ear. That is the main reason for the clinical examination, that it is very important, and not to do anything on our own. That is the main concept. So swimming might, yes? Not the eustachian tube, because eustachian tube is way behind your maxillary sinus. That I will come to you in the next nose thing, because your sinuses are here and your eustachian tube is more behind near the ear. See, if I, yes, here itself. See, here you are finding it, right? This place is your maxillary sinus and it opens here itself. So this tube is more behind where it attaches. So there's a lot of gap between the two. So I'll move on to our next session. We are finished with this. Next, nose. The beautiful organ right in front of us, in the center of our face, which is very beautiful. And so many of us are very much obsessed whether my nose is straight, if it have any bend, I need to look more pretty. There's so many people going for rhinoplasties, getting it repaired. But trust me, whatever God has given us, beautiful and wonderful. Only for the reason that it has a small hump or a small thing, do not disturb it. Whatever He has given is good. But when you have gone through a trauma, sudden fall, and something has happened, yes, then we will get it corrected. Don't worry. But whatever is being given, it's very beautiful. This nose is the center of so many things, so many problems, so many doubts, so many everyday things which happen. So, to brief you out, this is the septum which is there in the middle, whatever we can see in the center, which divides the nose to right side and left side. We have only one nose, but two sides of it. And when we come to the lateral side, this side, it looks like this. So, it has three, we call them turbinates. Gauche, Barjana. We find, I have lifted my nose, seen with a torch. I find two ball like things present. Is it a problem? No, it is something given by God. They are called the turbinates. And these do a very important function of filtering the air, humidifying it. Suppose you go to a dry place, you take a dry air inside. It has to go to your lungs in a proper condition. So, what the nose does is the mucosal layer, that is, here we call it the skin. The layer inside your nose, we call it mucosa. So, the mucosa is there around your septum and on these. That will filter the air, make hot air cold, cold air hot, like wet air dry, dry air wet. So it conditions the air perfectly to what you need and then sends it to your lungs. So it is a very major thing, a very important function. Any hampering with this, the asthma patients and all, they get triggers usually by taking air directly through the mouth, or any hampering of this, the triggers are more. What we think is any problem in the nose is not identified first. We think it's the lungs first. We're not able to breathe properly. We are having shortness of breath. I'm having some disturbance. Please do not worry, do not run. The air entry place is your nose. First, this has to be checked. And any problem here, correct it, most of your problems are cleared. So, what general issues you think you face with your nose? When you have this cold, too, you said cold. First, you should be able to define your cold. Cold means what happens to you? Yes, sneezing, nose blockage. headache, discharge from the nose. So these are the things. Because each and every problem you say has a different diagnosis. We have to remember that. Having sneezing is not normal cold. Having an obstruction, it has so many things as to why the obstruction could be there. Nose discharge as well, unable to smell properly, having a difference of smell, bleeding from your nose. These are the various concepts which bother us. And if we can't breathe normally for just a minute, we panic, our heart rate comes up. At that time, do not worry, just relax, take back a seat. And most of the bleeding issues which occur in either children or adults is generally in this place, because here the mucosal lining is very thin and this area is highly vascular. That means అక్కడ బ్లడ్ సప్లై అన్నది చాలా ఎక్కువ ఉంటుంది. There are four main vessels which come and end here. If you have good nails which you feel pretty about and one scratch in that area, your bleeding starts. Or if there is any crusting, because of dryness you feel some dirt is there and you try to remove it and it is attached tightly, just removing that also might cause bleeding to you. So if there is any bleeding from the nose, please do not panic. Okay, just press it, put an ice pack on it, and it will mostly subside. And later, once we see it, we will guide you on how to do it, how to reduce that infection and that lacerations which are formed. In elderly people, this might not be the case, because here we have a few blood vessels which are mostly important and related to hypertension. BP ఎక్కువ ఉంది. అలాంటి వాళ్ళలో బ్లీడింగ్ అయినప్పుడు యూజువల్లీ అట్ దిస్ ప్లేస్ ద బ్లీడింగ్ విల్ బి దేర్. దట్ ఈస్ కాల్డ్ ద పోస్టీరియర్ బ్లీడింగ్. At that time also, no need to panic. Control your BP, meet your general physician. Once that comes into control, slowly this bleeding will stop. Okay, this is the first initial point and a doubt where everyone has regarding the nose. If there is water leaking from your nose which doesn't go back after sniffing, you do it like this, still it is not going, it is continuously dripping down, that is a danger part. That you have to immediately meet a doctor. If it is bleeding, it's okay. You have good amount of blood in your body. You're active. It's okay. It can be handled. But normal water coming out from your nose, do not take any chance. Immediately get to us. Why? I will tell you. But there are these. This is a complicated one, but which we are seeing these days because of thin walls between the nose and the brain. There is this liquid called CSF, which you would have heard, cerebrospinal fluid. It is a fluid which runs in the brain actually, which will keep it lubricated. Sometimes, because of any fall, trauma, or the plate is being thin, spontaneous leaks also happen. This coming down is not a problem, trust me. But if you have a cold at that time and this infection goes back, it is a very easy entry point for any bacteria and viruses to enter into the brain and cause more complex issues. So, in those cases, we try to close off that whatever leak spot is there. We identify it through some radiologies, some CTs, and all, and we close it. So, this is one main thing with bleeding and water coming. Normal nose discharge, do not worry. And cold is different from sinusitis. There is a very huge difference between the two. So, how that comes? So, this is your nose, the central septum. These are your turbinates, which I told. Three are there on each side. Here up, it is a very small one. And these are your sinuses. Two maxillary sinus, as you have asked, and this is ethmoids. Here you have your frontal sinus, and one sinus is behind your nose. So, this is that sinus here, the sphenoid. Okay, so when you have a cold, not necessarily that every cold ends up in sinusitis. When you have a cold, it might go through this into your maxillary or it might travel, but not every cold is sinus. And even you or we cannot confirm if it is sinusitis or not. Only a scan can tell us. So any cold you get and you get a headache because of it, please don't jump into conclusions that I have a sinus, I have a sinusitis. One more thing is allergy, the sneezing part which is there. If you are having sneezing every day in the morning or small exposure to dust, that is not common cold. That is called allergic rhinitis. And it runs in the families. It could be hereditary or low immunity in your body. Your parents might have given it to you or any other factors. When you have this allergy, we cannot treat it completely, but we can reduce it. We can give you a better lifestyle. That can be done. Because of allergy, you might get sinusitis. Sinusitis can be secondary to allergy. So, when you control your allergy part, you are able to control the sinusitis also. And I'll tell you in the next slide the complications, what could be there through the allergy also. So, mainly the nose block, which you said, might be because of the bend in your nose septum. This is one major important thing. And this bend, see, it has to be straight like this. It can be bent like this. These are the different kinds of bends which we can see. Now, why have this occur? Anything could have happened when you were very young. Suppose while giving birth, it was a difficult delivery. At that time, it is very thin. It is a cartilage, very soft bone. That time, a bend could have started. And as you age, see, once there's a bend, it continues to be like that. It cannot get straight on its own. Or when you're flipping around, when the baby is flipping around, they hit the floor. At that time, the bend could be there. Or you're playing, you have grown up a bit. Friends punching, playing, there's a bend gone. So, at an early age, bends are common. After growing up, you go out with friends, bike, fall down, you have a bend. Or wife comes, you have a quarrel, she hits you, you have a bend. Sorry, I am not saying anything with the wives. Same thing is happening with husbands also. So, any traumas or sudden things, or sometimes due to repeated infections, when the turbinates increase in size and they give a lot of pressure, even in the septum, there are two parts. One is the cartilage in the anteriorly, and going back, it is a bone. So, when frequent infections increase the size of the turbinates, because of that pressure, also there could be bends. And that is also one of the reasons. So, when you get to a doctor and they tell you you have a bend, first thing what we do is, why did I get it? Where did I get it? When did I get it? Forget it. You have got a bend. Finally, it is there. What should we do next about it? Because it is an anatomical structure, because no medicine can do anything for it. Suppose you have a medicine which will melt your bone. How strong should that be? So, if it melts the bone itself, your whole nose is also melted, right? You don't have a nose finally. So, there is no medicine which can straighten this bend. So these days we have a lot of technology out there. Where do we do it endoscopically? So there is no scar, nothing outside. Your nose is as beautiful as it is now. We do it everything from inside. Set your septum to the center. If the turbinates become huge, we try to reduce them with lasers, microdebriders, lot of powered instruments now. So you'll be happily sleeping throughout the surgery. The surgery is done 10 days apart, you are happy. Then you start thinking, నేను ఇది ముందు ఎందుకు చెయ్యలేదు? Why I have been suffering from such a long time with nose blocks, nose obstructions, if the solution is this simple. So the first step lies with you to take it forward, get to a doctor, get your diagnosis. Whether you get it done or not is the next step. First, know about it. We order a small CT for it, where stage wise we get all the cuts to see where all the bend is. And the beauty of the scan is you also can see and identify. Once shown to you, next somebody of your friends have it. I've got a scan. Hey, show me. I will tell you if it is there or not. You can tell that. It is that simple and that easy. So knowing your nose is very easy for even a normal person. So as I said, this is the enlargement of your turbinate. So where normal nose cycle will be there. When we have a cold, This happens alternatively because when we have a cold, you might be experiencing nose block. Sometime it is there to the left side, then it gets cleared, then your right side is blocked. So throughout the night, you have alternate sides blocking. That is normal. One cell cycle comprises from 40 minutes to 4 hours in every individual. It differs. For a few people, 40 minutes to 1 hour, you'll have one side blockage, then it turns to the other side. That is not at all a problem. That is the body's way of giving you air even when you are infected. So don't take it as some problematic issue. That is the first thing. So what happens is when you repeatedly keep having infections and one side is getting more affected continuously, it might not go back to its normal size. That is the time where we have to come and start intervening. Till then, it is okay. But when you have it repeatedly, especially the allergy patients, especially those having repeated exposure to pollution, working in industries or sites, some construction sites and all, they will be facing a lot of these issues. So at that time, what happens is like this, we'll have different grades. So usually 1 and 2 grades, they will come back on their own, no need to worry. But when it is going to the next grades and when you're having complete obstruction, that is when the patient comes to us. And along with these, in almost 60 to 80% of the patients, we find they have a deviated septum, that is the bent nasal septum. That is when we identify, ask you to go down for a scan and confirm it. Even we blindly, without any evidence, will not suggest you for surgery. Somebody suggesting it also, please take back, think. So this doesn't mean going for a doctor shopping. Please no. Trust your doctor. Okay? And evidential. Today, everything is evidence based medicine. So you have it in front of you. So go according to it. Next, what happens? The sinusitis thing, as I said. So, if your sinuses are clear, you have only air in them. Sinuses are usually made by God to make your face light. Because if it is all with hard bone, your face itself is very heavy for you to carry. So, those places are designed in such a way that they carry air and they do not give you a lot of weight and tension. So, when there is any infection that is loaded, that is when you start feeling tenderness at this area, headaches, back of your head also you might be getting at this place. This is because of the sphenoid sinus that I mentioned to you. Because any infection at that place, the referred pain comes here. Every headache is not sinusitis. That is one main important thing that you notice. There are specific points. Every headache and you have a cold, please do not take it as sinusitis. It might be an impeding complication. You have a migraine already and suddenly you have a cold. It might be a trigger. So migraine is a different issue. Only one side you have it. You have a lot of stress in your office, tension headaches. A lot of headaches here. The whole head is paining. You have a throbbing headache. Oh my God, something is wrong with me. My head is spinning. I have a headache. Chalo, I'll get a scan done. I'll run to a neurophysician. No. There are 100 types of headaches and none are clear. Why you have a headache might not be a reason for that. So, do not jump every headache to a sinusitis complication. Only when it is infected like this, you might be having a sinusitis. So, this can be clearly seen on a CT like this. So if it is like this, dark, that means air is there in it. It is normal. If you find it grayish color, see this is the eye. Okay? If you find it grayish like this, then these are the infected sinus. This is how beautifully, nobody can cheat you with a CT scan. No doctor, it is there right in front of you. If it is like this, and sometimes only this lining might be thickened, that is also not deep sinusitis. In your reporting, even if there is 2% of sinusitis, it is termed as sinusitis. If it is 90% sinus infection also, it is termed as sinusitis. So if you get a CT-PNS scan and the report mentions sinusitis, do not panic because the radiologist will never tell you the percentage or anything. So we do not trust the reports. Suppose we ask you to get them done, please get the films. Let us see how much the infection is there. Can we deal it with medication or should we intervene and clear it off? In allergy patients, what happens is they might be having polyps like this because of allergy. It might appear like this. This time what happens is in the scan, we find a similar kind of a picture. So these polyps will fill up your sinus areas and your nose areas. At that time, you might be experiencing the nose blockage, obstruction. How many ever medicines you use, they do not work. Whatever you do, steam inhalations, it will not work. Please come to us. Get it cleared whether any polyps are there, any nose deviation is there, whether you're suffering from allergy. Let it get diagnosed properly. Then we will guide you to how to clear it. At the same time, when you have polyps, what happens is, see, this is the place where the nerve endings go, the ophthalmic nerves and all go. So if the polyps are very huge that they spread to all these areas, even your smell might be compromised. That is one point also for you to immediately reach out to a doctor to know what it is. So that comes to the nose part. Any doubts you have regarding this, you can just put them down. Yes. Madam, unless and until it is necessary, we do not recommend on it. But to know the exact condition of either be it your nose or the sinuses, that is the only way. Because even I can do an endoscopy, which is non-invasive, like I just put a scope through your nose and I see it. But it will not give me the status of your sinuses. I can only see your nose part and the exit from where they are. That means, see, here at this place your sinus opens. Only till there I can see. But what is there inside I cannot see. Sometimes what happens is with these polyps, if they remain for a long time, there's a lot of chance for fungal growth to occur. Fungal sinusitis is one of the most dreaded complication of allergy, sinusitis and polyps. Especially in diabetic patients, we ask them to be very careful. Usually diabetes is what we think any hurt to the foot, we should immediately go to a doctor, get it checked, we are diabetic because the pain sensations are less. Only till there we got restrained till now. But now you are diabetic and you have cold for a long time, please come to an ENT. Get your nose checked, get your sinuses checked, because this fungal infection also is hidden. It is hidden in your sinuses, it will not let you out. And a few kinds of funguses, they eat out the bone also internally, which is very dangerous. So that is a very big take home point for diabetic patients. You are diabetic, you have frequent colds, your nose is being stuffy, you're not able to come out of it. Please get to us. Otherwise, it'll. But once it is cleared, you are tremendously active. You are just rid of the problem. And we guide you to be careful of not getting it back again. And one more thing about the polyps is they can recur. Remember that. You have polyps, we removed them. It is not that they will never again come back in your life. But how to take care that they don't come back, we will tell you. We will help you out with that. But doctor has told me even if I remove, I will get them back. So why should I get it removed? If you keep it, you are the sufferer. You might lead up going into complications and breathing through your mouth starts where still a hell lot of complications come out. So that is the main reason. And you're young, you're not very obese, and you're snoring in the night time. Please get to us, get your nose checked. Because it is very important that you take care of your lungs and your blood pressures. If you're not having a proper flow through your nose, trust me, it leads to lot of unknown complications. Early onset of diabetes, hypertension, heart issues. It is not to scare you, it is just to enlighten you so that you will know what is the crux of the issues. Because these days we are in such an era that we are totally in a polluted environment. No food is pure. Organic is a name, is what I feel. But there is nowhere we get good food, no good air, pollution. In such conditions, we are trying to have good health. We have to take care of ourselves. So, how is that? Is about this. So, next, when we come to the oral cavity, Yes, questions, please. Yes. That's what I'm telling you. Whenever you have a nosebleed, that could be because of the dryness, that your the blood vessels are easily ruptured. Mainly, you should be hydrated properly. And when you have a nosebleed, please do not lean back. That is the first thing. Bend forward, close your nose, and put an ice pack. How much time? At least 7 to 10 minutes, block your nose, and then you release it, because there is something called bleeding time and clotting time which differs from person to person. So when you block it, the clotting time will act and it will stop the bleeding. After it stops, do not try to remove the blood clots by yourself. Give it some time. It will dry up, it will come out on its own. At that time, you can come to us, because most of them bleeding started. You will run to the ers, you will do their, what immediately they do is they pack your nose. Recently, 2 days back, I had a 9-year-old boy coming in. Patients got panicky. Nighttime there was a bleed. It subsided on its own. Again, next day morning, around 4 o'clock, it started spontaneously. They ran to the ER. The pediatric team has taken. What they did, the first thing, they packed his nose. So this packs, how they are is, they put the pack and a bit of saline or something, it will bulge. So it will put pressure on that. It's comfortable. The bleeding will stop. Through the other side of the nose is there and mouth is also there, that won't be a problem. So one more crux was, 1 year back we have done an adenotonsillectomy to the child. He was our patient only, so we know. First thing what I went there and saw, I saw his nails. Trust me, they were so big. All the nails were, pretty holidays, nobody taking care, the boys playing, jumping. What he did, dryness, he just tried to remove the crust, and that nail which was there has given a laceration in his nose. That is the point from where the bleeding is coming. Now, what happens is, not only the laceration, the dirt which is there in the nails enters into that place, causing an infection. So the first point, remove the pack. He is breathing freely. He is happy. Then we noticed it. Don't worry. We gave some ointment, some medication for the infection to come down. Happy. So that is the main reason. Do not panic if there is blood. Especially summers, winters also it will be there, because we have a lot of dry air around. That is the reason, which will give a lot of access to the blood vessels to be superficially out and easy to rupture. So please take care of your nails. They might be looking beautiful, good, and all, but it might cause serious effects for you. Yes, questions? Adenoids నేను చెప్తానండి. I definitely have a presentation and a talk with adenoids. I will come to that in the next slides. I will clear doubts regarding that. That also I will come to you. That is a very huge thing. I will get to it. Same thing. Same thing. Why you get blood in the discharges? It is blocking. You want all that to come out. So you keep on blowing it out. As I said, the blood vessels are very thin and superficial. A force blow, blood will come. And you'll start panicking. Don't worry. When you have a cold, don't try to blow it hard. Two things for it. One thing, the infection might end up in your sinuses. Second thing, it will enter into your ears, into your middle ear, causing middle ear infections. So, whenever you have a cold, just something external, try to just bring it out. Use some steam inhalations. Do not blow hard. You might have bleeding, you might have caused sinusitis by your own self, and you might have caused your ear infections. Anosmia depends on from how long it is, sir, and what is the reason. Sometimes no reason. Sometimes might be because of polyposis, and sometimes some crusts or any obstructions near that nerve area. So once, it's not that every time we have a specific reason for anosmia, but noted on time, and any of these conditions which are repairable are done, it can be reversed. And anosmia which has started during COVID, most of them has got affected. It has directly hit the nerves. So we couldn't recover most of them, but few of them in due course of time, as the virus has come out, and with the help of a few sprays and some medications, we were able to retrieve up to 60 to 70%. And 60 to 70%, they are happy. At least a bit of smell is coming, though it was not normal as before, but not 100%. We cannot guarantee. There are lucky people who have got their smells back, but it might not be same in all the cases. Any? What's it? Vertigo patients. Vertigo patients, firstly, what type of vertigo it is, we need to know. Whether it is because of, I shown you that otoconia, that is called positional vertigo. For that, we give you some medication and we try to tell you some exercises to do, which will try to normalize them. But if it is any infections which is causing the vertigo, we have a few tests called WEMP, impedance testing, Puton audiometries. We do that. No, at least till some what is the cause of it, and we tell you how to do care. So depending, yeah, positional. That's what. For that, we have some vestibular exercises. So we tell you, we give you a sheet of those exercises. Even they're available on net also. So we ask you to start doing those. It might not give you an immediate result. So that time we give you some medication so that it will stay under control. Along with it, when you do these exercises, in due course of time, they will come under control. And you can wean out of the medication. It's not that forever you have to use the medication. It is just supportive. But if you do not do the exercises and use only medication, it will never become normal. That is one point. No, it is, see, normal. Initial, what we tell is some eye exercises where you move your eyeballs up and down here and there. Some movement, positional exercises will be there that you can keep doing. And after daily till your vertigo comes under control and you're comfortable, you will know that. You will know the progress of your vertigo. And you're comfortable, you yourself will stop it, however. And again it starts, again you'll get back to it. So that's all a cycle. But doing it every time, it doesn't do any harm to you. And they're very simple exercises. Very simple. Yes, that is normal because whatever mucus is secreted, that will block your nerve area, which is at the top. So once that cold recovers and all, it will come. If it is a common cold, no need to worry. It will come down by itself once all your viral load is gone and the nose is cleared. It will get normal. No, 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 no. Absolutely no. That I will come to you later. Anything regarding the nose? Yeah. Even I have come across this, madam. Most of them suggest to take a flu vaccine before the rainy season starts so that the viral loads and all will reduce. Basically, it's not that you don't get it. Please be sure and clear of it. Suppose you're prone to get it 10 times. You might get it 2 to 3 times and it might be under control. And the studies show they are effective, but in a few of them, a neutral study has been there. Whether you take it or not, mainly please concentrate on building your immunity. And flu vaccines, especially in younger children and in older generation, we are advising them because we can at least reduce them. Children, how much ever you do, you know how good their immunity levels are. They go play, do not wash hands, eat off something, immunity comes down, they run, sweat. See, those things which were normal previously, we are having to be extra cautious these days. Not even we ate without washing hands, we ate everything, but we were healthy then. At least a bit of immunity is there in us now. But what for our kids? They are totally, very glass guarded children nowadays. Yes, please. No, it might not be, sir, because most of the colds and all, they are viral. Okay? Kids getting a viral once, twice, or maximum thrice is like okay. But what happens here is Your kid gets a viral infection, gets a cold or a cough. It comes down. In a week, it comes down. He's happy, you're happy. But he transfers it to you, to your wife, to children at school. It is contaminative. So it goes to everyone. By the time it reduces for him, again he might catch it with somebody else. Catching it in that way is not a problem. But catching it in that way very frequently, and the adenoids which you were talking about and the tonsils which will come about, they are the lymph organs which will give you adverse effects because of these continuous infections. And as you said, we think they are to build immunity only till a certain level, not beyond that. So that is where our point comes to get it checked if everything is normal, if it is building immunity or if it is destroying their immunity. That is where we have to be very careful about. Exactly, that's what I'm telling you. See, once he's got an infection, body has fought with it and the organ has increased in size, and later he doesn't have an infection for a long time, then even the adenoid which is there, it's a lymph organ, it has reduced in size, happy, the body is fighting. But when he repeatedly has these infections, what happens is the enlarged size of the adenoid will not get back to its normal size. That is when it starts interrupting with the regular everyday problems. That I will get back to you. I have a slide on that, I have a talk on that. So I will make it a bit quick because it is 8 o'clock already. I think I'm going a bit slow. So coming to the oral cavity, we have a throat pain, we get panicky. First point everyone says is, I have tonsillitis, my tonsils are enlarged, so should we remove it? No, not every throat pain is tonsillitis. This is your oral cavity. So this is called the posterior pharyngeal wall. This is your small tongue called the uvula. These are your tonsils. Okay? Usually this is the picture which you have. So when you have a throat pain, it could be pharyngitis. So when the whole infection is spread out in your throat, it is the most common reason for your throat pains. And this is the tonsil enlarged in size along with infection. If this size is persisting, be it in a child or an adult, we suggest you to get it removed after the infection subsides. Even for that, there are conditions. You are getting a throat pain frequently, every almost in 6 months 3 to 4 times, and whenever you're getting it, you are having a fever along with it, and you're having to use antibiotics every time. If all these conditions fulfill and your tonsils are very huge like this, only then we have to go for tonsillectomy. Otherwise, not needed. Even if the tonsils are big, but you don't have any this kind of a history, there is the chance for them to get back to their size. So, not in every enlarged tonsil, tonsillectomy is required. But if you're having it repeatedly with all other comorbs, you definitely have to think about it. And then, when you have any ulcers in this area, even that could mimic your throat pain. Even that could cause throat pains. So these are some other conditions where you have mouth ulcers frequently occurring and you're like, they are not going what to do. Basic reasons for this, your gut. Trust your gut. If it is not proper or you have any vitamin deficiencies occurring, then your oral ulcers are frequently prone to occur. At this time, what you should have is take proper multivitamins, make your body fit, increase your immunity, and definitely that is the most important factor for this. And we have a few small gels and ointments which will numb that area to let you eat something. So that will not remove them off, it will give you some space, because when you have this with that lot of pain, you won't have food, which will still reduce your vitamin and mineral intake, and it will not heal this up. So at such times, what you have to do is take more of food, take more of greens, fruits, increase it. You can take the help of some multivitamin medication that will actually clean it up. And your gut is not clean, you're more prone to have these. And this kind of a picture on your tongue is a very clear depiction of your vitamin deficiencies, dehydration. Your water intake is not good, it will definitely show you clear signs. Initially, we will not recognize it. We'll think it is a small thing, something has occurred. But our body is suggesting us that something is starting. Some of you might be just taking 2 to 3 glasses of water, which is very less. You say, we are very busy, we're not having time for anything. Please make time. At least 2 to 2.5 liters of water is a must. Otherwise, it will start from here and the whole system goes to the next level. So, this is one of your initial indicators: skin dryness, tongue. This is called fissuring of the tongue, and spots like this. So, take care. Your dehydration status and your vitamin intake, these both have to be checked. And this is called a contact ulcer. When you have any sharp tooth, so this kind of an ulcers can be your buccal side, that is the outside of your tooth, or inside near your tongue. So when such ulcers are there, you think same again, vitamin deficiency, you keep taking medication, but it is not coming down. That is the place where you come for a checkup. We see for the sharp tooths. Go to a dentist, get the sharp tooth blunted, and your problem will gradually come down. So this is one of the causes. So your main thing, snoring. Children is first what I'm concentrating. The same thing goes to most of the adults. So the adenoids which you're talking about, usually they are placed here. So if they are in normal size, see, this is your eustachian tube opening which I told you. Back of the nose, from here it goes. When you have an infection, the adenoids, they increase in size like this. And after the infection is done, sometimes it go back to its normal place, because there's a lot of literature which says 7 to 8 years the adenoids reduces, so don't worry, don't go for surgeries immediately by most of the pediatricians. They keep pumping you with meta sprays telling it will come down. But please trust me, there are two kinds of ways where the cells increase. One is the size of the cell increasing, the number of cells increasing. When the size of the cell increase, it will come back to its normal size. But if the number of cells increase like this, it will not come down in size. That is the time where we have to go for removal of the adenoid. So what happens? Don't worry, nothing happens when you remove the adenoid. Yes, God has given it for a specific purpose. But after a specific age, whatever the function these adenoids and tonsils do are taken up by a lot of lymph nodes which are produced in your head and neck region. So all that fighting activity which the adenoids and tonsils are doing, those lymph nodes will take care. But if you allow the adenoids to remain like this, main problem which takes place is the air is not going freely through the nose. Then what happens? The child or the adult starts taking air through the mouth. So, whatever function the nose has to do, as I told, the filtration, the humidification, all those are hampered. So, the air directly is entering into the mouth through the throat to your lungs. So, first, what happens? Mouth, frequent oral infections, enlargement of the tonsils, tonsillar infections, and lungs getting affected. That is the reason when we have anyone coming with tonsillitis, we check for the adenoids also, especially young children. And these days, because of various factors of pollution, food, and everything, we are finding grade 4 adenoids even in a 4-year-old child. And we are operating because it is mandatory. Otherwise, what happens? They are having various kinds, the face structures are changing. They're having the palates all coming up, a lot of puffiness in the face, no proper sleep. Ears get infected because the eustachian tube is blocked. Any infection going into the ear can't come out. The adenoids are blocking them. So we are seeing hearing loss in children. That is a very most important red flag. Any child you're seeing they're not responding, it's not because they're not attentive. The ear starts getting affected because of this. So it is a very most important thing. Coming to adults, there is a very big story regarding snoring, which is difficult to cover in this session because I will at least need only 1 hour for that. So when this path is blocked and air goes through here, there are multiple areas where it can get blocked and the snoring happens. So we have a particular regimen to deal about obstructive sleep disease. In children, snoring occurs due to mostly the adenoids. In adults, it could be the nose, the deviation of the nose, the adenoids, the tonsils, the lateral walls, and going down till the, here we have the vocal cords. Till here, any place can get obstructed. But luckily in children, the two major places we see are the adenoids and tonsils. No one should go for mouth breathing. Please remember that. No child or no adult, because your most important functions are hampered. You should only breathe through your nose. You have a soundy sleep of the child. Usually, when you sleep, it is very silent. That is the way it has to be. But when you see some sound, the breathing sounds that you're appreciating, or they're opening their mouth and breathing, child is running, playing, coming, and he's gasping for air. Please, these are the red flags. Get it checked. So, what are frequent colds and coughs? Any nasal obstructions, mouth breathing, frequent ear pains, throat pains associated with fever? Along with tonsils, the problem is there. Along with adenoids, tonsils are also being a problem. And you're using a lot of medication for your child. No, don't do it. Even a child or an adult. Why should you use and why others are not using? That should be your first point. Right? Any doubts you have regarding this? That the food you take, the timings of the food you take, that is all again a big topic of this dietetics and all coming into action. And our people also say, please have food in the daytime, sun time. Have an early dinner. Whatever you take should be more of fresh things, fruits, everything like that. So the lifestyle modifications, less of maida, white things, no white things, no sugars, take good amount of water. Please do not exceed 3.5 liters of water, which will include your teas, coffees, juices, everything. 3.5 is the max, because taking excessive water also has many side effects. Your brain swells up, your electrolytes are pushed out of your body, sluggishness starts, you don't know why it is happening. And in elderly patients, we see disorientations because their electrolytes are flushed out because of it. So these are all could be there. So where water is very effective, it could be fatal also. So these are the various head and neck issues which you can come across and get to an ENT. So especially here you have the thyroid, and this place is below your chin. So there you have these deep neck spaces, submandibular areas. So any infections in that, suddenly you have it swollen up. Please get back. It is an emergency, because any pus is being there accumulated. We need to drain it up and put you on proper antibiotics. Same way here you have your parotid. Sometimes you get here. It is a salivary gland. Here you have submandibular, sublingual, any of the salivary glands getting affected, get to us. Any lymph nodes. So like this, you have lymph nodes which are grown in size. Immediately we need to take care of it. It's not that everything, the only final solution is surgery. No. Knowing the proper diagnosis, treating it on time, very, very essential. So these all also come under us, and we do deal with all the head and neck issues. At the same time, see, this is the submandibular gland. And as have shown you, the tongue and buccal cavity, if there are any lesions like this, it might not only be the contacting what I told you, we need to know what it is. Small biopsy confirming what it is. If it is a normal one, normal medication, treat it off. But a few people, it might turn to some benign lesions, malignant lesions, where knowing it early will give us a proper role for it. Okay, I'm clear on this. And this is the final thing. Why do you think ENT is clubbed? So, nose is the center one. I'll show you a picture. Please don't get scared. So, here, nose is the center part. This is the cause of all the problems. So, what happens? You take in air, it is going into your ear through this tube. Cause is starting with your nose, and you are unable to breathe properly. Mouth breathing, your oral cavity gets into issues. So, ENT is totally interrelated. Any problem anywhere, three of them have to be checked. If your ENT is not checking, if you go with a ear problem, your nose and oral cavity should be examined. If they are not doing it, only seeing your ear, writing medication and sending, your problem is not solved. Most of the ear and throat issues, nose is the first point to be checked. If your nose is fine, you don't have a problem with your nose, then perfect. We can go with the symptomatic treatment or more in-depth analysis of your problem. So most of your issues start with the nose, end up with all the other places. So that is the main reason. So you have a throat pain, you go to a general physician. Trust me, I think 20 to 30% of them do not even examine. They write down the medication, send you home. Most of the cases start there. You have a nose deviation, it is not encountered, and only a throat pain is treated. What is the use? What do you get out of it? Nothing. Every time you go, you take a medication. Sometimes, the easiest thing done, go to a medical shop, take an augmentin, take an amoxicillin, use it for 3 days. Then after fourth day, it is not coming down. Then go to a doctor. Trust me, these days augmentins, amoxicillins are not working. They have become resistant. Please don't do those mistakes because you're introducing chemicals into your body. You're making a dump. Don't do that. Every throat pain, every cold doesn't need an antibiotic unless and until indicated. You have any doubts now? Definitely, definitely. Because sometimes in children, if it is not identified and it is left like that, now we have adult patients coming with snoring problems. And we have a few tests for that, some endoscopic, diagnostic endoscopies. And when we are doing that, very surprisingly, we are finding grade 3 to grade 4 adenoids in adults also. Yes, size of it. We have four grades. Grade 1, which is pretty normal. Grade 2, a bit larger than that. But grade 1 and grade 2, we do not do anything. We leave them. Sometimes due course of time, they just, reduce or you're growing, your head diameter grows, it gets. But grade 3, grade 4, it is coming there. We sincerely advise you to happily get rid of it to avoid further complications. We will not do anything, madam. We will not do anything. Mouth breathing also could be that they have a bend in their nose. So, usually in kids of younger age, if there is a bend in the nose, we do not operate immediately. Previously, we used to tell them to wait till 17 to 18 years of age for a nose septum correction. But now we have revised on it because their important years of education comes in that way. So we see it around 12 to 13 years. If it is really problematic, the adenoids are normal, we are operating now, trying to give them a good airway. And then we will relook at it after 19 years or something if again a correction is needed. If it is all fine, we can leave it. We have to see. We see if the nose is deviated, there are no adenoids. That young age, we cannot do anything. We try to give them some steam inhalations, some decongestants, so that the other mucosal areas doesn't swell up. That is what we can do. Age, madam, can happen. Possibilities are there. No, that is a habit. It is not because of any of this. That is just a habit. They are being cranky. Don't feed the child till he comes to you and says he's hungry. Then he will eat whatever you give. Sometimes, definitely. If there is a lot of blockage, the grade is very high, they gasp for air. In gasping for air, your small tongue, the uvula beats, all the muscles come closer. So it will be a problem, definitely. Yes, yes, yes. Good question. So, what happens is whenever we have a viral infection, there's secondary bacterial infections attracted towards it. So, whenever there's a viral infection, possibility of secondary bacterial infections as they're very high, we start them on antibiotics so that it doesn't aggravate the issue. That is one main point, because according to studies, 80 to 95% of the viral infections do land up in secondary bacterial infections. So that's why I told you, when you have a viral infection in your throat, we find only a bit of congestion. So we don't immediately give you an antibiotics. Depending on the stage of congestion, anticipating there could be a secondary infection, we start you on antibiotics only then, even for fevers. So if a doctor is giving an antibiotic for a viral fever, please don't mistake them. It is for good only. It will avoid. Otherwise, you'll have to go on higher doses of antibiotics, and hospital stays also might be needed. To avoid all that, we are doing this. We have to intervene, sir. We do a surgery called functional endoscopic sinus surgery. So, in that, we go endoscopically. From outside, we do not do anything. We go inside, we try to opening the entrance of the sinus, drain out all the infection, remove all the infection which is there in the sinus, and leave it free. Because next time when you get a sinus infection, only when you use the medication, your problem is solved. So, every time there will not be a need to go for a surgery for a sinus infection. So, but not every time the sinus will clear on its own. Because if it is completely filled with infection, we definitely need to go intervene with the surgery to remove it. After that, the medication will definitely start working. And the background of the sinus also matters. If it is because of allergy that you are getting the sinusitis, or because of a common cold, the bacterial invasion, if you have got a sinusitis, depending on that, the treatment protocol keeps changing. Yes. So, whatever the nerves are there, madam, they are very much interconnected. So, when you have a nausea, even when you clean your ears, also sometimes you have a vertigo, spinning sensation. So, there the nerves are very superficially placed. That is the reason you might be countering them. So, because the similar nerve supplies the similar places, interrelation, that is the reason you might be getting that. So, no need to worry. Just take a deep breath, take a time out, relax for some time, take some fluids or some food which will soothe you. Sometimes you might not be eating anything and going on a flight. So, you'll have that anxiety, tension. At the same time, your pressures are not met. Because of that, also something is happening, stress movement, you might be experiencing that. So, it is just that interrelation which is there. Eosinophils is the allergy component, madam. So what we do is, usually, previously we used to get this AEC, absolute eosinophil count, IgE. These are the few blood tests which we do. So usually in allergy patients, these are elevated. So after seeing all this for a decade from now, we have noticed that we do this blood on a allergic patient or non-allergic patient, we are finding the levels high. So instead of putting the patients through this painful blood drawing, all these things, seeing the clinical examination, the history of the patient, and how they are suffering, and the treatment that we are coming up, we are finding very good results. And yes, there are a few patients who ask us, no, I want to get it done. Okay, please get it done. No problem in that. But at that point, when you get it done, you might see your eosinophil count normal. So that doesn't mean you don't have an allergy. So see, it is all very tricky. The body, how it works, how it shows up. So not everything every time is confirmatory to you. That is the reason. If required, we ourselves tell you, no, no, let us get it checked and we'll be confirmatory about it. Then we can go ahead with that. Any other questions?
Sorry to pause.
Yeah. 5 minutes, we'll wind up with 2 to 3 questions. Oh, sure, definitely. Please, 2 to 3 more questions, don't mind. Please. చాలా తొందరగా రికవర్ అయిపోతారండి. యూజువల్గా ఎడినాయిడ్స్ ఒక్కటే చేస్తే 1 వీక్ to 10 days, అసలు ఆన్ డే 3 ఇట్ సెల్ఫ్ ద చైల్డ్ ఈజ్ హ్యాపీ జంపింగ్ అండ్ ప్లేయింగ్. టాన్సిల్స్ కూడా చేస్తే ఏంటంటే, డైరెక్ట్ ఫుడ్ ఇంటేక్ అక్కడి నుంచే వెళ్తుంది కాబట్టి, అది హీల్ అయ్యే వరకు దానికి తగులుతూ వెళ్తుంది కాబట్టి కొంచెం పెయిన్ అన్నది ఎక్స్పీరియన్స్ అవుతారు. అయితే ఈ స్నోరింగ్ ఏదైతే ఉందో, ఎడినాయిడ్స్ తీసేసిన వెంటనే వాళ్ళకి రిలీఫ్ అనేది వెంటనే ఎక్స్పెక్ట్ చేయకూడదు. ఇట్ విల్ టేక్ 2 to 3 weeks for that swelling to come down. Whatever we have done, the operative area, swelling comes. So once that swelling comes down, then you will find the actual result of the surgery. So the recovery time is very decently less. No need to worry about it. And children recover very fast. Yes, madam, that comes when you tell us your history properly and our clinical examination confirms it. As I said, not every sinus issue is regarding the common cold or the sinus, what it is. We cannot confirm your sinus without a scan. But immediately you come with a problem, we do not do the scan. We first try to treat you, give you some medication, and after that only we will get a scan to confirm if it is really sinusitis. So small problems, it might be only an allergy or some common cold. Do not take every cold for sinusitis. How? I only don't know. How can you know? Madam, I'll tell you, allergy, deviation, sinusitis, they mimic same complaints. There's a very thin line of difference. So that is the place where we come into play. So according to what you say, kind of problem you're facing, that is the way our diagnosis differs and your treatment differs. So you will have to, I think, spend around 8 to 9 years of education for you to know it by yourself. That is what I can tell you, because it has a very thin line of difference. No, grade 1 adenoid, I don't think much. No. Deviated septum could. That also depends on how much it is deviated. A mild deviation, we'll just leave it off. But if there is a very gross deviation and your turbinates are very much enlarged, it could lead to snoring. Definitely. We are seeing a lot of patients with that. Need not adenoids be the reason for your snoring every time. Only the nose septum also can be a reason. You have to get it corrected. Today, not today, tomorrow, you have to get it corrected. The earlier you do, you'll avoid your complications. That is always recommended. Might be. As I said, it will, the turbinate size keep on increasing. Push, push, push. What happens? It cannot resist, no? Because opposite side there is place. So it can push. It's giving you that. Yes, that is a very apt thing. When you're starting to experience hearing loss, please immediately meet us, because there are different types of hearing losses. If your nerves are getting affected, that is called a sensory neural hearing loss. Once it starts, it continues to decrease. We cannot stop it. So, we recommend you to use hearing aids to stop it from further deteriorating. We cannot give back your lost hearing, but we can help to stop reducing it from there. And anyone have a sudden hearing loss, suppose something happened, immediately come to a ENT, because sudden hearing loss treated within 24 to 36 hours will give back your hearing. If it is delayed, trust me, it will be drastic. We can't give back your hearing. That also only 60 to 70% we can give back. So that's a very important thing. And somebody having the hearing loss and a hearing aid is suggested, please take it. Why do you have specs? It is blurred. You can't see. So we are being selfish about it. I have to see. Hearing, why you don't care? The other person is shouting. Why do I need to take care of it? They will shout. I will happily sit. No problem. But it will affect you on your long run. So it is very precious. Out of your senses, hearing is very precious, which you have to take care of it in a very childlike manner. So do not neglect it. So thank you all for your presence today. And if really required, I will come back to you. We can have more question and answer sessions. Because today you know what are basics about. Now after this session, your doubt starts. I am available in Gaman Hospital here. My team is also here. So Monday to Friday evenings I'm here. You can get to me. Any doubts you have, anything to get checked, because a doctor's role doesn't lie only in seeing, writing medication, and sending. Sometimes there is no problem. And what all you need at that time is a proper counseling, proper way to know what it is, especially throat issues, swallowing issues, your blood count is low, you have a lot of swallowing difficulties, frequent throat pains coming. Sometimes there is no issue at all, but still you're feeling something is there. That is a point, that is a place where I come into your action. You're well, you're good, but how do your brain process it is all how it matters. Psychologically, you're fit, physically, you're perfectly all right. Physically, even some problem, and psychologically, you are very down, it all reverses. So, we will not move towards this side, we will go to the positive side and make our lives, health, and everything very much happier. Yes, thank you.